Doc is back. Welcome to Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join Doc and his guests as they discuss healthcare and the Caribbean community every Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms.
I didn't grow up here, but Broward County has become home to me. This is where I settled. I raised my family here and started my practice here. For over 20 years, I've represented my neighbors, people who needed help in a stressful time. If you find yourself in need of an attorney, reach out to someone you can trust, someone with a proven track record.
When a car accident or personal injury sets you back, call Scott McCullough.
954-989-3435.
Hello, ladies and gentlemen, and welcome to this week's episode of Medically Speaking with Dr. Winston Alexis. So, Doc, before we get into this week's topic of pregnancy, we had a listener who sent us an email with a question. The question is it true that fibroids shrink after you get to menopause?
Yeah, that's a true statement, but shrink is one thing. It don't shrink overnight. All right?
Okay.
It takes weeks and months to get smaller. Because think of it. If you have a fibroid like a breadfruit, right? It don't come like a lime overnight.
Gotcha.
Right? It takes years. Just as it takes years to reach there, it takes years to come. That's a simple answer. So yes, they shrink, but slowly over time.
And is there anything that needs to be done, or is it just...
Well, I think the question the question is if they're very large and causing problems, waiting because you go through menopause doesn't make sense. Because when it's big, if it's resting and squeezing your bladder, it's going to squeeze your bladder for years while it's shrinking.
Gotcha.
So it all depends on the symptoms you have. But they do shrink, but slowly over the years. It doesn't suddenly shrink.
All right.
Okay.
Thank you for that, and thank you so much for sending in your question. Ladies and gentlemen, please email us your questions to questions@cacpros.com. Again, the email address is questions@cacpros.com. Today, we are going to ask Doc to speak a little bit about pregnancy. A subject that I would imagine that he is quite the expert on. Doc.
Yeah, but a lot of it's still confusion. There are mysteries about OB, obstetrics, not gynecology, that we still trying to figure out. Some is folk law that is hard to get rid of, especially when they come from countries like we come from. Let me give you an example. Right? I was supposed to see Duppy.
Yes.
You know why? I'm telling you why. I was born at home, and the amniotic sac burst, and I was born with what they call a veil. Normally, the sac open up and the baby come out. The sac of water, the baby is in there.
Yes.
It bursts, the water gone, and I come out. Some people come out, just the leakage was through a small cavity. So when I was born, it was still on my face.
Okay.
And in Trinidad, when you're born with what they call a veil, you're supposed to see Duppy. So I started off with some old talk. So when I get big man and I'm doing OB I'm doing my resident, I went home and I said, Mommy, by the way, how old you say in Trinidad, we used to call it Jumbie.
That's what you call Duppy.
Jumbie, yeah, Jumbie.
Okay.
So I said, how come you tell me I want to see Jumbie and I see none? She said, no, I know why you don't see no Jumbie. I said, how you mean you know? She said, we kept the little stub from your umbilical cord. You know, you go with a little piece.
Yes.
Dry it, grind it up and put it in milk. What? I said, Mommy, what you do? you grind up part. Then I said, my Lord. She said, no one there you see no Jumbie. But by the way, you know there are materials in the placenta now.
Yes.
You heard the saving placental blood.
Yes, I know.
Where they have germs, what do they call them again? The cells that they're fighting about to get that could form any other cell in the body. I forget the name of it. I'll remember it before we're done. But those cells will help people with transplant, maybe at a later age, or if you need, it's virgin cells before they start to divide. Okay. Stem cells.
Yes.
Right? And umbilical stem cells is very different from, we have stem cells too, but they are called adult. Those are the same kind of cells that when you get cut, it start growing and full up. But the cord blood and the placenta is loaded with those cells. And what they are doing with children when they're born, they say, listen, let's collect this blood for you, freeze it, it could last forever. So if later on in life you come up with something where you really need to have some stem cells, you have your own. Interesting. Right? Yeah, but anyway, the Jumbie was more interested.
Well, yes. And now you know why you never...
Now I know why I'm so strong. It's all them stupidest my mother give me to... No, but pregnancy has been always loaded with I could give you a billion anecdotes with what people believe about pregnancy that have nothing to do with the truth, far away from the truth. So, you know what? I found myself in a funny situation because I grew up in a system where folklore was the world. I was delivered by a lay midwife, not like he had never go no training down the road. And she came there and watched my mother have my birth, and I weigh 9 pounds. It just means that my mother had the adequate body to suit that.
Mm-hmm. Her
exactly. So we are lucky
are...
because there are many bodies in Trinidad that didn't make it, where the babies died at home by the time they get them to the hospital. This is why, but we were okay with that. Everybody is
acceptable.
Yeah. Not every baby is going to live. In America, is a different thing.
Right.
They want the impossible. So when I came up here, I felt something. People are not willing to accept the fact that not every baby will be perfectly formed. Not everybody will develop. Not every baby will be born alive. And they hold the obstetrician responsible for things that he really have no control over.
Right.
So I thought it would be good to kind of, what is more important, I think, here is to let women who are pregnant or want to become pregnant understand exactly what we do as gynecologists. Actually obstetricians.
Mm-hmm.
All right? Give you an example. I'll tell you what we are about. My mother, I think, is 11 of us, 2 died. She never make no fuss about it. And they die. I ain't talking about no 2-pound baby, big baby born and then dead. 2 of them. The 2 before me. They claim that's why my mother loved me so much, because the other 2 died in her arms.
Wow.
But that was accepted. I was like 10 years old when I really realized the 2 babies. I was wondering how there's such a big difference between the years of my brother and me. Right? But if you look at the children back in the 50s and 40s, this is how it went.
You're giving away age now.
No, I told my mother and father in the 40s. Why are you interfering with me, Rude? So, if you look, me and my brother, we about 1.5 years to 2 years in between every child. You know why? There are no birth control. My mother will have a child. Thank God she breastfeed for a year. And during that year, you get some protection against pregnancy. Then she stopped breastfeeding. 6 months she pregnant again.
Right.
And then 9 months for the baby. No wonder we about 2.5, because they use natural contraception, which was vigorous breastfeeding. I talk about breastfeeding here, you know. My mother breastfed every meal until I was 1 year old. Well, not 1 year, at least for the first 6 months or so, even though I breastfed for a whole year. Right? Every meal, 2 o'clock in the morning, 4 o'clock. Then people here say they're breastfeeding. Oh, yeah, I let the baby feed 2 times at night. I am breastfeeding, I'm making joke. If you want to get the protection against pregnancy, breastfeed every meal.
Okay.
Because the thing that actually gives you the protection is sucking on the nipple of a woman who have just had a child. That stimulates the brain to send out a hormone that make the breast make more milk. So the suckling is important to the next meal. You know, but when you're giving the baby bottle, all of that doesn't count. So that's part of the thing I want to go through. What is the difference? One is that people in third world countries, we can't compare pregnancy, caring for a pregnant woman in third world countries and here is day and night. Right? Why? Let me give you an example. They don't even bother with much prenatal care in those countries. They try the best they can do. Let me give you I don't think these are the exact figures, but it's close enough. I think it's somewhere like either Somalia or somewhere. 1,000 babies die for every 100,000 birth. I think it's about 27 in America, and they're still cussing. You know what's the difference? We give prenatal care here, and they don't have any over there. That is the difference. So we divide pregnancy into the important parts. Prenatal care. You know, every pregnant woman I heard, they're wondering which hospital I go in. The doctor won't come for my delivery. And listen to me, it's 40 weeks for the baby, and it's 12 hours at most for the delivery. Which one you think is kind of more important? Right? And we do it like that because we are able to save literally thousands of lives with good prenatal care. So out there, rule number one, forget the hospital. Most of them do the same thing. Get a doctor who can follow the guidelines and give you good prenatal care. Then your baby stand a chance and not just being stand a chance of being normal in size and function when it's born.
So let's talk a little bit about prenatal care then, if you...
All right. What the principle behind prenatal care is, look, let's find out if this woman have any pre-existing condition that can affect the pregnancy. Rule number one.
Okay.
Right? Then the second part of it is there certain disease you only find in pregnancy. Down syndrome. So we screen for that. You understand? I mean, later on we go down, we screen for the STIs. They don't call it STDs anymore. Disease is sexual transmitted infections. Okay. So you'll see the word STI instead of STD. STD sound dirty. So they decide to take the D out for the disease and I, which is really a true indication of what it is. We test for diseases like thyroid disease, high blood pressure, diabetes prior to the pregnancy. So every woman who is thinking of becoming pregnant, you need to go and see your regular primary care, get a good physical examination, get STIs checked, get thyroid checked, make sure you are in good shape prior to the pregnancy. That's number one of prenatal care. It's called preconceptual counseling.
Gotcha.
Right? If you have sickle cell trait, we check your husband to see if you have a trait and give you an idea what can happen. So prenatal is to look for things that you could find out early so you could start management at early. The second part is to screen for diseases that only occur in pregnancy.
Okay.
Right? I have a bunch of them. Then the most important part of prenatal care is following the growth and well-being of the baby. Two different things. Growth and well-being. All right, listen how the difference between the two. Simple principle. Healthy babies grow at a special rate. We have charts of how they're supposed to grow. Give you an example. One of the reasons I think I believe in a supreme being is because there's so much order in the growth of the baby that is amazing. The baby grow 1 centimeter a week. That means if you measure from the top of the pubic bone, that bone down here, to the top of where the uterus is as it gets bigger and bigger, the number of centimeters you get equal the number of weeks. So that's one way we can measure whether and that have too much order to start from some damn big band somewhere in the dark hole. That work out too convenient. But anyway, that is what we do when the patient come every month and we check the length of the baby to make sure it's growing. Second part is to talk about the well-being of the baby, which is the baby healthy?
Right.
Yes, it's growing. That's a good news. But the second part is it healthy?
And how do you measure the health?
All right, there we go now. We measure the simple things. Is the baby moving?
Mm-hmm.
People, healthy babies, move. And women always coming, oh, this thing moving so much, it hurting my belly. I say, good. Because healthy babies move.
All right.
Sick babies do not move. And by the way, it's not in early pregnancy. I will say that is from about 24 weeks on. The movement is very important. Prior to that, it's too small to really determine exactly what's going on. But look at it. Anything that delivers before 24 weeks is an abortion anyway, so nobody cares what it is. But once it's established, 24 weeks and above, we should, and one of the first questions I ask the patient when they come into the office, is the baby, good morning, ma'am, how are you? How is the weather? You listen to Trump and he foolish. No, I'm sorry. And then the next question is your baby moving? Yeah. Once I hear that, it's probably okay. All right? But there are other things. If I don't think it's okay, I could send you to the hospital and get 2 tests done that will make sure that the baby is all right. So that's what it is. That's the second part.
Got it.
First part is to head off condition. Second part is to monitor the growth and development. The third part is there are some serious diseases that occur in pregnancy during the latter part of the pregnancy that can threaten the life of the baby. One is called preeclampsia. You don't even know what it means.
You're right.
It doesn't matter. High blood pressure. The mother could end up convulsing. She swell up. We are scared of this because it could kill both mother and child.
Yeah.
Right? Then you have all kinds of bleeding. In the latter, we call it the last trimester. Bleeding, high blood pressure, all of those things are very important because they crop up at that time and they can threaten the life of the baby. So there is something, I don't know if I should bring this out later. All of you young ladies who is fighting for your husband to be in the labor room, beating him over the head if he say he don't want to go, sit down there, he's serving absolutely no purpose except you are making him suffer as much as you. He serves no. Now, I'll turn it around. Bring him with you every prenatal visit.
All right.
Because there's certain advice we are going to give to the mother that the father needs to understand. She's going to need help in certain things. And she going home and tell him he ain't going to take it. Bring him. Rather than thinking he's staying in the labor room and getting in the way with camera and TV.
See? All right.
Right. I know Mr. Alexis was saying foolishness, but
that is for nowadays, fathers.
Yeah, man. But
nowadays.
But the truth is, if we talk about helping the male, he could come and see the things you have to do. We give them a whole lot of instructions. Lay down on your left side, stand up upside, all kind of thing. And many times husbands don't understand that. They think, oh, she just said, I want to be able to impress on them. Listen, you need to have a count when the baby kick in, because that is important. Instead of you going down there and drink, all he says, yeah, I got to go in the delivery room. What are you doing in the delivery room except getting in the way?
It's easier than being with her every day.
So I'm putting you guys on the spot. Yes. You think you get away? If you have a choice between going in the labor room and going to her with her visits, you serve a better purpose going for prenatal care.
All right.
All you do in the delivery room, and it's okay. Moral support.
Yes.
But moral support have absolutely no effect on the quality of the outcome of the pregnancy.
So from a quality perspective, you should be with the mother of
as the
child.
As the process is going on.
Right.
You could be of more use. I could see all the mothers saying, Dr. Alexis, all right, you are to come.
All right, ladies and gentlemen. We're going to take a short break and we'll be right back.
For excellent surgical care, call Dr. Ralph Guarneri's office at 954-462-8714. Dr. G is a general surgery specialist, experienced in surgery of the stomach, liver, spleen, pancreas, and gallbladder, to name a few. Dr. Guarneri also specializes in trauma and transplant surgery. Schedule your appointment with Dr. Ralph Guarneri today by calling 954-462-8714. That's 954-462-8714.
And we're back to Medically Speaking with Dr. Winston Alexis. So, Doc, we left off with the importance of prenatal care, but I have a question here that came in that I should have tried to get to you earlier. The question is, when should I worry if I've been trying to get pregnant but can't?
Okay. Very good question. All that is part of, remember I say, pre-pregnancy counseling.
Yes, yes.
We go through all of that. Once you get your physical, you say, well, but doc, I haven't been using no protection for 5 years and nothing happened. So part of that preconceptual counseling is actually this very question.
So you and the father to be have made a decision that you want to have children.
Go get a good physical and some counseling from the doctor who will tell you what vitamins you should be on, and what precautions you should be taking. A simple example I'll give you in reference to this. There's a lady who I was treating for infertility, and I given her some fertility pills and something. I give her about 4 months. Maximum you should go is 3 or 4. But she dung on me, doc, I don't understand. I said, but I check you out. We do all the tests. You're normal. Well, I don't understand what happened. She said, doc, I don't understand what to. So I say, you know something? I need to see your husband because I want him to. No, doc, he live in Jamaica. I said, what? Wait, hold on. How you mean he live in Jamaica? She said, yeah, he come up here about once every 3 months for a weekend. How you gonna get pregnant? How in the heck are you going to get pregnant? So I realized then she didn't understand the pregnancy process. As most of our listeners, a woman can only get pregnant 48 hours in every month. 48 hours the egg is available. So it doesn't mean that when you have sex, you're supposed to get pregnant. It's stupidness. As a matter of fact, if a woman isn't getting pregnant, the first thing I tell her to do, make sure. Now, if you're getting pregnant, you need no advice. You're doing something right. But if nothing, make sure you have sex every other day. Every other day, easy to understand.
Yes.
It's 48 hours the egg live.
Unreasonable at that.
There you go. But you can have sex once every fortnight or month and come and tell me, I don't understand. I don't understand why you're getting pregnant. There are no sperms in your vagina. That's why you're not getting pregnant. No, but all of that is part of the pre-counseling, okay? So, and infertility is a standardized workup.
Yes.
I don't care who it is, we do the same thing. We check your tubes to see if they're open. We check you to see if you're releasing your eggs every month. And we check the man to see if you have enough sperms and they're swimming. That is all. Infertility, plus a good physical exam, that's all. Right? And if a woman in the pre-counseling tell me that, I say, honey, hold on. Don't talk about this pregnancy thing yet. So let me talk to you a little more. Get some more particular. I say, listen, I'm going to have to see. First of all, the man either going to have to store his sperms and send it, or you go down and he come aboard, you're going to have sex. She was about to you have to be here a lot of times. Yes. Right? She was going to throw away hundreds to almost $1,000 to find out why she ain't getting pregnant. And that is the best example I could give you of how pre-conceptual counseling is important. Okay. But that answers part of the question. Yes. It's not that easy to get pregnant. When you're young and you're having sex every night anyway, or every other night, no wonder young people get pregnant all the time.
Yes.
Right? So it's very good question.
Okay. All right. So back to prenatal care then.
Yeah.
So you left off
where we look at the growth.
Yes.
And I'm telling you now, I will send them to the hospital. They'll give us some answers. And I'll tell the mother, nothing to worry. Once we test them, they're all right. So the fact that you're not feeling it doesn't mean anything. Okay. We don't go just on the decreased fetal movement. That's a sign. Mm-hmm. That's a yellow light, not a red.
Okay.
And then I have to send them to see if we get the red light. Once you get the red light, you got to do something about it. Otherwise, the baby's going to die. And that's something most of the time is try to deliver the baby. The problem with that, if it happened at 30 weeks, the baby's going to be premature with a whole lot of problems when it's born. Right. So I have to balance the act. If it's having a little trouble but it's not dying, I may wait 3 days later to see if we could. And by the way, they have found that every 24 hours makes a difference in the survival of a child. Meaning if you're 30 weeks, people who go 31 weeks, the babies do better than 30. 32 do better than 31. So it's a day-by-day decision. Once the baby starts to run into trouble, right? Regardless of what the trouble is, we try to fix that. But that is not the main thing. I watching the progress of this baby.
When you run into situations like that, are the mothers typically hospitalized? Or yeah, okay.
Once you have that abnormal well-being, hospital.
Okay.
Without doubt, growth.
Round the clock monitoring.
Right, growth may not be immediate. We may search and see if we could find out why it's not. Well-being means they're about to die.
Gotcha.
That is hospitalized and day by day monitored and evaluate by the patient, by the doctor. Right. As a matter of fact, we get consults from a special group of doctors who deal with problem pregnancies called perinatologists. When I run into a jam, I get some advice from them because they are trained one step ahead of me.
Gotcha.
Yeah.
Okay. Actually, I have another question here that kind of you kind of touched on it a little bit. The question is, are there activities I should avoid during pregnancy?
Right. Guys, you're gonna love me for this. Ladies, I'm sorry. If there are no complications, you can have sex all the time. I know the ladies saying, Jesus, what Dr. Alexis is telling this man. Don't get me wrong. The woman doesn't feel like it. And you have to respect that because that's something we need to talk about, the regular changes that go on in normal pregnancies. That is a bigger problem than worrying about problem pregnancies, right? Yeah. Most pregnancies end up fine. I was saving a question for later that the troubles that women have to go through during pregnancy, right, is much more important than worrying about getting some sophisticated disease called preeclampsia. Most women don't. Now, we talk about it because when the outcome is bad, you tend to focus on the bad thing. But that doesn't happen. Believe me, emergencies, life-threatening emergencies where the baby is going to die, doesn't happen that much in pregnancy.
Okay.
Most of the times we are monitoring the growth, well-being, and then monitoring the labor process. It's all about monitoring. When disease crop up now, we learn to jump on those diseases, but most of the babies I've delivered in 50-something years are normal babies.
All right.
With no complications. Right? It's just when they come ready for that too.
All right. So outside of sex, any other activities?
At one time, we used to withhold exercise, and we found out now it's wrong. Generally, pregnant women can exercise. There's one major, two really. Don't hurt yourself, because a woman who's pregnant don't have the same balance. She don't have, so you have to be careful of that. And second, you never do any exercise where you're panting, where you're short of breath. Don't want to do anything where you're going,
okay.
When you finish. But we advise, go to a trainer. Don't do it by yourself. Tell them you're pregnant, and they are trained in telling you what exercises pregnant women. Let me correct myself again. Up to 10 years ago, I used to tell women, no, most you could do is walk. That is wrong. I've done enough studies to say that you can go to the gym, you can exercise, but never do it to fatigue.
Okay.
And the best thing, go to
a professional trainer.
A trainer.
Got it.
And once you tell him you're pregnant, he'll be able to tell you what you can do.
All right. You ready for another question?
Yeah, man, I'm ready. I like the question, and that way I don't have to think too hard.
So We are now getting into the pregnancy and heading to the delivery.
Right. We'll leave that. I know. That's what everybody wants to hear.
Yes,
but we have a few more things to talk about.
We have a few more things.
Right.
So what is the normal amount of weight gain during pregnancy?
Actually, we used to pay much more attention to that in the old days. Right? They're standardized. Anything you could look online, any book. However, let's be realistic. That's for people who have good normal weight. When 3/4 of America is overweight. Right? If we're going to call that a serious, that means the whole country in trouble. What weight does for you, people who are overweight, who gain too much weight tend to develop more high blood pressure during the pregnancy, diabetes during the pregnancy. They have more problems with labor and growth of the baby. So it's not a good thing. Now, the exact figure I don't have, because when I'm ready, I go look at my chart and they tell me. And by the way, it depends on the patient basic weight. It's not a skinny woman could gain more weight than an overweight woman. So it's not standardized. It depends. And I don't remember it. I actually go, we have charts stick up all over the office. And what's your height, what's your weight? Okay, you should be gaining so much pounds. And the average in the old days, we used to say about 2 pounds a month. That's the old days, but that's no longer, that was just a generalization. But now they could almost scientifically tell you if you weigh so much your height, this is what you should.
Okay.
Yeah.
All right. Well, ladies and... Sorry, go ahead, Doc.
I want to talk specifically about the problems women have during pregnancy, and that's more important than the bad disease and bleeding and pressure and disaster in labor. Believe me, that's minor. The biggest problem I deal with, number one, all these complaints that pregnant women have. And number two, convincing her everything is all right. Right? And that's why I want the guys to come. I want them to hear what they complain about every time they come to my office. Right? And I try to answer all. And by the way, about 75% of the question, I don't know why. All I could tell them, you are well, and the baby is well. But why you asking me why my second toe hurt me half the day on the third toe, and the third toe at night? That is the kind of question, some question I never see no book yet. And there's nothing wrong with them. Pregnant women feel pains and discomforts that we have no clue why.
So you don't have the answers for cravings and
no,
all those things?
Very few of them. He come and tell me, I feel so well. I say, me too, you know. I get up beside us in my head, and they usually start laughing. I say, okay, give it to me. Tell me now. And they start, my head hurt. I said, that happened in pregnancy, woman, head hurt. I can't move my bowels. I said, that happened in pregnancy because your bowels slow down. But that, answering those questions and following the format, making sure we do all the screenings, making sure is what real prenatal care is. And that is what helped us to move from 1,000 per 100,000 to 27. Right? Not the labor, not the delivery. I have very little to do with it. And I'd save that for last because that's the one women like to hear.
Yes.
Right. So tell me when I could let loose with that.
All right. We're going to take a short break right now. And then when we come back, we can get into that. We'll be right back, ladies and gentlemen.
UroSurge Associates is a full-service urology practice in Plantation, Florida, with 3 board-certified urologists offering expert care in most disciplines of general urology. At the helm is Dr. Paul Kahn, who is board-certified in urology, a fellow of the American College of Surgeons, and an expert in robotic surgery. As a proud Jamaican American, Dr. Kahn attended medical school at the University of the West Indies and completed his residency at the University of Miami-Jackson Memorial. Since 1983, Dr. Kahn with his dedicated team have been committed to providing the best possible care to patients. Call 954-474-2929 to schedule your appointment today. That's 954-474-2929.
And we're back, ladies and gentlemen, to Medically Speaking with Dr. Winston Alexis. Doc, you ready now?
I'm ready, you know.
All right, I'm going to start off this segment with a question.
Oh God, okay.
Because we're going into labor and delivery and these things now, you know. That's where we reach.
They don't want to hear what I wanted. I want to talk about all the complaints pregnant women have. We're going to do that later then, and what trouble them.
All right, let's talk about that.
Okay, and then we leave the nice part for last,
All right.
labor. 100,000 different complaints women have, and they are real. You look at them, they're looking all right, and you think it's real. It is real. The problem is it goes with pregnancy. It doesn't mean anything wrong with you.
Unexplained, but goes with pregnancy.
No, and even the ones we can explain. Why some people have it worse, and some people... All pregnant women have the same changes in their body. How come some women vomiting like they're dead? They can't eat. And my wife tell me don't talk. And people like Mr. Alexis, me even know she's pregnant. When the baby was 4 months, she said, by the way, you know, I think I missed my period. That's how I know we had children here too. I busy in school, but I had no time with that. She might say, hey, when somebody, way, you know, I don't think I see my period. Right? Never had a day of morning sickness. Some women can't function because of the morning sickness. All right? And how do you explain this? Simple. Because all pregnant women have the same changes in their body. Mm-hmm. Apparently, the woman's personality and her reaction to what is happening causes the symptoms to escalate. For instance, everybody have a little nausea. I asked me, she said, yeah, I think so, you know, but I have a thing to do. I have no time. I have to drop my children to school. I got to cook food for you, and then I got to go to work, and then go to school. So she literally don't have time to
feel sick.
It have some people come in, they wrap up with a cup in their hand, spitting, can't keep the thing, can't move. And I'm saying, Jesus Christ, nothing really wrong. When you check everything, it's all right. So here's her reaction to the terrible feeling that a pregnant woman, and all of them, listen to me again, people, all of you pregnant women have it, is how you respond to it. How much it interferes with your quality of life.
So let me ask you a question now. So how do you address this? When you have a woman and them come in and them poorly, boy, doc, my belly, my throat, this or that, I don't feel well.
I rough them up now.
Okay.
Let me tell you why. But in a nice way. They know me. They know I love them. I would say, well, you know what I'm to you? It's something named pregnancy. Mm. Right? That's the first thing I start. In no strange condition. Mm-hmm. And you come in here with a cup in your hand and you have to fight this thing.
Okay.
Right? Yes, you feel like crap. I'm not saying you don't. Number one, everything they tell you, that's how they feel. You have to tell them, listen, man. Let me say this, people. My boss man, I would say, get up and make my breakfast. No. No. That's what my father would say. I dare not. Say, I don't care how sick you are, get up, cook my food. No, but the idea is...
Guys, do not try this at home.
No, you'll get shot. Listen, but you want to get up and say, oh God, I feel like crap. I'm going to drink my cup of coffee. Guess what happened? Shitty feeling. I go into work, you know.
Yes.
And I go in and do my job. And I'm going to pick up the children from school. Attitude. And I've used this in 16-year-olds. And they do better than people who are 40 years and 9 children.
Okay.
In other words, I indoctrinate them from, listen. And when she leaving, I'll say, listen, don't come back here next week looking like it's your last day on earth. You should be ripened like a Julie mango. You know, you're with child, you should be bubbling.
Glowing.
Thank you. What's this? Oh, God.
Yes.
With a cup. No, man. And you know, I've seen the results of that, especially the younger women.
Psychological.
Yeah, one girl came here and said, oh, doc, you see, I have the cup today. I say, yeah, man, I'm proud of you. But the point is, gentlemen, number one, they feel, I'm not saying they don't feel it.
Okay.
They are having everything they tell you. But you have to understand this is what happened to some pregnant women. And it should not stop you. You may slow down a little bit from your daily function. Worst thing to do when you're pregnant is to stop working. You get sicker by the day. You could reduce the amount of work, but please don't stay home. You get miserable and you get, so I feel for them too. They come, they have indigestion. I'm giving you the symptoms now. That's because you're pregnant. Food doesn't empty from the stomach when you're pregnant, so it boils up and you get indigestion. You have constipation, that's because you're pregnant. The bowel doesn't go through and churn the food as good as when you're not pregnant. You have hemorrhoids, pregnancy. Your legs swell up, pregnancy. Okay. Your head hurting, pregnancy. I feel like crap, pregnancy. So fight it back.
So fight it back.
Yeah, man.
And gentlemen,
support. Support them.
Be firm. Be firm.
Yeah, but support.
But support.
Right.
All right.
So, in other words, you call them and say, listen, don't bother cook, eh? I'm going to stop by Popeye. Give me one of them 2 sandwiches there and some fry. Rest yourself, honey. And some sugar cane sweetened iced tea. It's sweet, you hear too. You ever had that?
Yes, sir.
Remind me of Jamaica.
Yes, sir.
No, but be nice. The men understand she's not feeling well. Don't support her in laying down and doing nothing, but at the same time, ease it up. You could say, okay, honey, you know what, don't bother. I will do this time.
All right.
I will do. Right, well, labor is a different thing. I even want to get there.
Well,
because the woman will kill me. They tell me they won't kill me. That's stupidness. I told the girls in my office.
It's pain.
And it comes with the territory.
Yes.
Right?
So, we're ready for that?
Yes, man. Yes.
All right. So the question. Should I get an epidural or not?
Me and my daughter cross paths on this. Because she's a mother and obstetrician, I am not.
Okay.
And she happens to be a woman, I am not. Mm-hmm. She happens to have had children, I have not. Mm-hmm. So I bow a little to her. Right? But let me go through what it is. It is not necessary. How I know that? Epidural only come out about 20-something years ago. How all them women from 1432 up to now deliver? Mm-hmm. It's a normal process where pain, don't get me wrong, I'm not saying no pain medicine.
Okay.
Sure, we give you things to help you, but epidural means absence of pain. I personally have a theory that God make that painful for a reason. Mm-hmm. And I think I know the reason. By the way, don't tell nobody, this is in nobody's book. This is my theory. I think that pain has something to do with bonding with the child between mother and child. And secondly, I think the pain has something to do with the final maturity of the baby. Because we know stress, for instance, improves lung development in the child. Mm-hmm. A stressed baby, one of the first things to mature is the lungs. Can't prove it. Nobody has been able to prove it. But I happen to believe everything that happened with medicine is a reason. It's just we haven't worked the why labor pain yet.
I'll go beyond that.
So, all right, let's say so. I don't believe in getting rid of all of labor pain. I agree with blunting it. I agree with making it as comfortable as you can. But let me be realistic. That's me. Mm-hmm. I'm in the minority. Let me repeat that. I am in the majority and a minority. And people tell me it's because you old and them things never used to happen. Maybe. All right. Now, epidurals, the problem I don't like with epidurals is it can cause a little fetal irregularity when you first get it. It's only temporary.
Okay.
Normally, it corrects itself. But I don't like anything
right.
that possibly can interfere with the well-being of the baby. Let me tell you again, there's nothing wrong with getting it because it corrects itself relatively easy by giving the mother some oxygen and some other things. So I'm not saying epidural is dangerous. I'm just wondering whether it's interfering with the normal physiologic process of labor. Right?
Reasonable.
But we going saying that the pains have no purpose. I don't believe that.
Well, again, and we are men, so...
Yeah. And that's why, didn't I tell you I bow to my daughter?
Yes.
Right? And if I, for instance, if a patient asks me that same question, I say, sure, you can have epidural. But I'll also say, it might cause little things to know what you're doing. They'll correct it, but be prepared. Don't get flabbergasted when they say, the fetal heart rate falling.
Right. Now, is this discussed, or at what point is the epidural discussed?
All right, let me explain now. There's some women, as they hit the door, they start asking for epidural. The right time for an epidural, we have to establish that labor has started. Not every woman who 9 months with pain is in labor. How do we know that? People come there and we send them back home.
Got you.
Right? So once we establish it's true labor, and we have ways of doing it. I can't go through that now, and you're no doctor, so you don't need to know. But there are ways we can tell. And once we establish it's true labor, epidural could almost be given as soon as we do that. Right? It shouldn't be given prior to the onset of labor. That's my belief. But some women, they won't feel no from the time they did epidural. And I have to tell some of them, you even ask me if the baby doing all right, you're going for epi. Right? All of that. By the way, some of this comes into the pre-counseling. This question, when they come and talk about baby, I say, talk about pains, you have to deal with that. They have epidural and they have this, and I give them my beliefs, but I always tell them, I am not saying epidural hurts anybody, baby. It's just in my mind, I don't like to know anything cause the baby had to fall. I don't like that.
Okay,
all right. And remember, a baby who born alive don't mean it might not have long-term consequences of what is happening in labor.
All right. Anything else along the lines of labor that you want to share with our listeners?
You mean as to whether the guy should be you trying to get me in trouble here too. I said some of it before. Look, I give you my point. If you choose between being in the labor floor and that helping the pregnancy in some way, or I think being there every visit with your wife during the process, during the whole 40 weeks, is more important than one night.
All right, time better
holding a hand. However, let me tell you right now, 98% of the women right now saying, that is foolishness. Don't worry, Dr. Alexis, you come in. Let me tell you something. You are going to be my pet. One lady tell me. I said, why? She said, well, they must see how much I suffer. I said, okay.
Yes.
Well, that's social business, eh?
I was there for my 3. So.
Right. I was drinking Pabst Blue Ribbon when Dr. Alexis was born in a little pub up from the Howard Hospital named Kenyon Bar and Grill.
All right.
I'll give you a joke about that too, And that, by the way, very important. Those days we don't know sex and no baby. Everybody bothering me in the office. Why is this sex? Number one, people, listen to this now. Ultrasounds are not done routinely in pregnancy to tell the sex of the baby. Ultrasound is done to make sure the baby is developing enough, good, and they may see the sex. So when and it's never on the report. So when I see it, I don't know. If you want to know the sex of your baby, when you're having your ultrasound done, ask the technician, you tell me what sex it is.
Okay.
Right, so remember, it's not done to determine sex. But the person who's doing it to make sure the baby is developing normally, many times can see it, and if you ask, can tell you, but it's not my responsibility as your caregiver to tell you what sex the baby is.
Got to.
Right? Okay, and I could give you some advice from my days. I was telling you, this is where the argument come up. I drink with my boys, and I buy one big box of cigar. Because I want a boy. Is a boy come in? So we up there drinking some rum. I was an intern, so I told one of my teachers was delivering her. So I tell one of the guys, look, call me up by Kenyon. Tell me when the baby. Them days we have no
cell phone.
No, so there's no Kenyon Bar number. So they call me, and I go and say, yeah, it's a boy, it's a boy. It's a girl. Listen now, man. And the press going back to the table. Because the boy started to laugh at me. You have a big bottle. Where you should I get this some donut? They say only real man could make man child. You're going to need to go and buy some donut for that child. Right? And she turned out to be the one who listened to me and was good enough to graduate and become a doctor. And God bless, it was a girl and not a boy. Not that I have anything against Wayne. But but that's how we used to do it in the old days. And by the way, I didn't come and see her, What? I asked the boys. So everything all right? Yeah, man. All right, kiss mommy for me. Tell her I want to see her in the morning. Wait, that's how we used to do it. I don't want to see my mother with crap coming out and blood all over.
Right.
Who want to see the wife leg up? Listen, so what I do, next morning I went, my baby in a green outfit. I think a yellow. Because these days, because we had no sex, you can't buy blue or pink. Otherwise you're going to end up.
It's something neutral.
Right. So I think my baby was in a yellow and mommy in a nice nightie and thing. Clean up her hair, brush up. Kiss her, I said, Mommy, oh God, nice baby. That's when I saw my baby. I saw my daughter the morning after, clean and that's my personal opinion. If I had to do it over again, see him ding. I don't want to see my wife in that position. Everything in the world with things coming from her. No.
Yes.
I still remember Mommy, I remember. Yeah.
Exactly.
But boy, this is the new world. Yep. Now I tell you already, Rennie husband was there ready to cut cord and all of that. And I look at him and say, listen, I'm auntie. Well, a big man like you, 6'9", what are you doing in And his word was, boy, you want my wife to kill me.
Exactly.
Yeah. But yeah.
So let us know, I guess, this part now, the delivery. Let's talk about that for a little bit.
Labor and delivery is simple. I don't mean to monitor it. That's my job. Two things. There are a set of things trying to push the baby out, which is the labor contractions, and there are a bunch of things resisting it. The major thing is the bones of the pelvis that the head have to come through. Right? Plus the blood vessels and tissue down there resisting it. So it's a fight going on, That's why they call it labor. They don't call it you're having a nice time. It's labor. The contraction pushing this baby through the bone. And the baby's head is adapting itself to try and make it. And it's not a straight tube. It's spiral. They take a mold of it. Let me tell you what I mean by spiral. When you look at the widest areas at the top of it, is different from the widest areas in the middle.
Okay.
So where you might be wide up here, side to side, when you reach the middle, it's wide up and down. So you have to turn to that way. So the baby head is constantly adjusting to the difference in diameters at all level of the pelvic bone. And that's the battle going on. If the labor contractions win, we have a nice baby. If the bony pelvis and the other things win, cesarean section. And that's the leading cause of cesarean sections. Not all those big disease, bleeding, preeclampsia, they're mine. Most sections are done because the baby cannot negotiate the diameters of the pelvis, even with strong contractions from the uterus. So the contraction trying to expel it, the bone is resisting it. And you can see, the bigger the baby head, the more the resistance. So bigger babies have a harder time going through. So most of the time, we section people because the babies cannot negotiate. And by the way, baby don't have to be big. People think the only time you need section, it could be small, but it can't negotiate it. That's the point. It can't make the curves it need to make. That's the best way for me to explain it.
Okay.
Right? And by the way, the stronger the contraction, the better. Because it's something where it starts slow, and the more it progresses, and the more the baby descends, the stronger it gets. So women should actually be happy when the labor pains get stronger because it means it's closer to the end. And of course, during that time, we monitoring the baby heart to make sure it's not doing bad either.
Of course.
Because I don't care if it's coming down or not, if the heart starts... And by the way, remember, every time the mother contracts, the baby not getting any blood. It ceases, the blood doesn't travel through the placenta during that time. It's only after it relaxes, the blood goes through the baby. And it's like you diving in the sea and holding your breath.
Okay.
And then you come up to get some more.
Mm-hmm.
Healthy babies, just like you could dive all day and always come up for a couple of minutes. Healthy baby can do that. They can go X number of minutes without oxygen. The blood has enough. But a compromised baby cannot put up with that decrease of blood flow every time the mother contracts. And they run into trouble.
Okay.
And that may have nothing to do with the size of the baby. That's another dynamic going on. So it's two, pushing the baby out, and three, making sure the baby is healthy enough to put up with those times of little oxygen coming to it. And a normal baby can, like you diving and come back up. You're going to die if you go down for a couple of minutes and come back. Same thing with labor.
All right.
So you see my job now in labor, and I really don't need no man saying no, they ask me stripping the story. I have enough trouble dealing with the patient. I can't say that, yes, ma'am. But when you ask me foolishness.
All right.
No, ladies, I'm joking. Take your husband, yeah? I don't deal. Dr. Alexis is going to kill me, really. Because she believe in them epidural and husband. If you see, she's hold up the baby so the husband could take picture and cut cord. And I'm there helping her and saying, what is she doing?
Encouraging foolishness.
Right. And by the way, and again, this is in no book. This is personal. And I always like to look at nature and everything. How does nature do this? There is something I cannot explain. Almost every child I know have a special relationship with their mother.
Mm-hmm.
Right? My father was the motivator. My father was the intelligent one. My father was the hustler, the guy who could do 16 jobs at the same. They used to call them entrepreneurs, yeah. My father, he was, boy, Jazelle is a hustler. He doing 16 things. He have truck. He selling land. He selling scrap iron. He have nightclub. You understand? And my mother was a semi-literate woman. She could read and write. That's it. Walk barefoot most of her life. Little Indian woman, they cooking. And yet, even though my father is responsible for what I am today, there's something I feel for my mother. Never felt for my father. Never. That is labor. Listen to me. That connection has to be labor. How I feel this way about my mother. You could tell me anything about my father when I'm young. I kill you if you say something about my mother.
Yes.
And that's how most people are. Mm. That's why now when I see my kids are all close to their mother, I don't pay no attention to that. That's normal, I think. And I think that bonding happens during the labor process. And the more we could keep out of the way, the better.
All right. So the baby is here now, and we have a question. The question is, I've had breast implants. Can I still breastfeed my baby?
The answer offline is yes, depending on how much breast tissue you have left. You know, some implants they put under the breast. Some of them, they remove breast tissue, and then it depends on the job. Okay. And frankly, the best person to ask that is probably plastic surgeons.
Okay.
All right, but as far as I know, and I can stand corrected, if anybody know differently, call and let us know. I think if it is just an implant and all the breast tissue is still there, they can do it.
Okay.
Right, but I'll tell you what I'll do. I'll check my boys in plastic surgery.
Yes.
And when we come back the next time, if you remind me, I'll give them the true answer.
All right. So, ladies and gentlemen, this was Medically Speaking with Dr. Winston Alexis, available on your favorite podcast platforms. Spotify, Google Podcast, Apple Podcast. New episodes every Thursday at 11:30 a.m. Eastern Standard Time. And please send us your questions to questions@cacpros.com. Email us your questions to questions@cacpros.com. Don't forget to support our advertisers and sponsors because they're the ones who support us. And remember, this is a production of the Caribbean American Connection. For the absolute best obstetrics and gynecology care, call South Florida OBGYN at 954-452-4377. Schedule your appointment today with Dr. Winston Alexis, who has been serving the women of South Florida for over 25 years. Conveniently located in Plantation, Florida, the courteous and professional team at South Florida OBGYN are standing by to assist you. Schedule your appointment today by calling 954-452-4377.
We appreciate your time with us on Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join us next Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms. Doc is back. Although the host and guests are qualified professionals, they assume no responsibility for inaccuracies, omissions, inconsistencies, and any slight of people or organizations. Listeners should use their own judgment or consult an expert or their personal physician for specific applications to their individual medical problems.